By now, you should have had your chat with your chemo nurse or specialist about the symptoms to watch out for during your chemotherapy. If you haven't, pause this video and watch it once your chat is complete. You have been carefully selected by your chemo team to have a home care monitor to help you be aware, manage and check these symptoms. It is not designed to replace a human carer, but to complement them. Our vision is to simplify and improve the treatment you receive and in turn reduce all unnecessary travel and relieve your anxiety and stress. We've made using it simple, but behind the scenes you can be confident that it's passed years of NHS approved clinical tests, and because it comes from Philips, you can ensure the technology makes no compromise on effectiveness and safety. So the next question that needs answering is, what does it do? How does it work? And what do you need to do when using it? Using your monitor. When the monitor is delivered, you will need to leave the packaging somewhere safe. You won't need it until your chemo has started. Your chemo nurse will train you how to use it to take your blood and temperature and monitor your symptoms before the first time you need to use it. Don't worry. Your nurse will ensure that your device is all there, working properly and completely accurate. She will also make sure the device is personalised to you as instructed by your doctor. Checking your blood. You will be told how to hold your hand with finger outstretched horizontally in a gun-like position before lightly pricking your finger. As soon as you have pricked this finger, you'll be shown how to allow it to form a teardrop-sized blood sample. Allow the bottom of the droplet to touch the sample hole on top of the cartridge. You will see there are red arrow marks on the top surface of the cartridge to show you exactly where this hole is. Your small drop of blood will be enough to fill the thin channel in the white circle. The cartridge is then simply placed in a cartridge holder in the reader, and your blood test from this point is fully automated. Although you may be a bit apprehensive, there's no need because it doesn't hurt. Diabetic patients do it every day. The machine knows if you've given it enough blood and whether it's enough to be analysed properly. Checking your overall health. What's happening here? Well, simple questions like how many times have you been sick? How is your sleep? Do you have any pains, a rash, nausea or fever? The sort of questions that don't require specific medical knowledge. Checking your temperature. The wireless thermometer next. How accurate is the reading? Well, it's very accurate, and because it's automatically beamed to the sender, it saves you having to read it and type it in. As everything is checked and rechecked by the device, it means mistakes are far less likely. Most of the time, it's checked against what your own doctor has set as normal and sent back as all clear. But if anything is not quite right, your chemo nurse is informed and she can give you a call. There's absolutely no need to worry about wasting anyone's time. We'll always choose to call if we think something's worth checking. We might simply ask you to take the test again. Either way, you can rest assured that someone is always aware of your symptoms, checking how you are doing, and ready to call and offer advice if needed, even when you are at home or between treatments. Remember, the home monitor is complementary to your doctors and nurses, and at any time you feel, you can and should contact your usual carer if you are worried about any symptoms you've heard about in your chemo chat.